What if I told you that for women after 60, leg circulation matters more than it does for men, and the most common exercise might actually be working against you? As a women's health expert, with years as a chief executive officer in the pharmaceutical industry focused on women's health, I've seen this pattern again and again. Many women over 60 do everything they're told. They walk faithfully, elevate their legs, wear compression socks, and still deal with swelling, cold feet, and unstable balance. Here's the part most people don't realize. After menopause, veins weaken, fluid drains less efficiently, and bone density declines faster, especially in the hips and legs. That's why circulation problems affect women differently than men. In women, this quietly increases the risk of slow healing, skin problems, and dangerous falls. And the solution has nothing to do with walking more steps. In this video, I'll show you 4 science-backed exercises you can do at home, ranked from least to most powerful. And number 1 works very differently than what most people expect. Once you understand which muscle actually drives circulation in women after 60, everything you've been told about exercise suddenly stops making sense. Let's start with exercise number 4, the glute bridge. This is often one of the first movements doctors recommend to women with heavy legs in the evening. And here's why that matters more than you think. When the pelvis is positioned above the heart, gravity actively assists the removal of pooled fluid from the legs. Blood and lymphatic fluid are no longer fighting upward. They're guided out naturally. For women over 60, this is especially important. Pelvic congestion and lower leg swelling are far more common after menopause, and joint-friendly options become limited. The glute bridge addresses both problems at once. It supports pelvic circulation while remaining gentle on the knees and hips. The science behind this is clear. A study published in Angiology and indexed on PubMed found that raised leg exercises were significantly more effective at reducing edema and venous congestion in older adults than resting alone. In other words, simply lying down was not enough. Elevation changed the outcome. That's why this movement is so powerful despite its simplicity. To start safely, lie on the floor or on a bed. Bend your knees and lift your hips slightly. Hold for a short time, then lower slowly. No force, no strain. Tip: using slow nasal breathing during the hold can further support fluid movement and relaxation. For many women, this is the first exercise that makes their legs feel lighter the very same evening. But lighter legs don't help if you don't trust them. And that's where most women get stuck. That brings us to the next movement. This one isn't about swelling, it's about stability. Number 3, single leg stance. If you've noticed hesitation while walking, a fear of uneven ground, or a subtle loss of confidence, this is often a sign of declining balance control. The single leg stance targets exactly that. Standing on one leg forces the body to coordinate small stabilizing muscles while maintaining blood flow through the supporting leg. This trains microcirculation at the same time it sharpens neuromuscular coordination, the communication between the brain and the muscles that keeps you upright. For women, this matters more than most people realize. After 60, hip bone density becomes a central factor in long-term mobility. Exercises that load one leg at a time help protect that area while reinforcing balance. These are 2 key requirements for staying independent. This isn't just theoretical. Research from the National Institute on Aging, often called the NIA, consistently shows that how well a woman can stand on one leg after 60 is one of the strongest predictors of long-term independence. To start safely, stand near a wall or chair. Lift one foot slightly off the ground and hold for a short interval. Then switch sides. This is not an endurance test. Tip: quality matters more than duration. A few controlled seconds are more effective than forcing a long hold. This exercise doesn't just train balance, it trains the ability to trust your legs again. That restored sense of balance creates the next shift. Once stability returns, circulation no longer just supports standing, it starts moving with purpose. This is where blood flow becomes active, not passive. Number 2. Heel raise hold. If you're dealing with swollen ankles, visible veins, or consistently cold feet, this is often a sign that the calf pump isn't doing its job efficiently. The calves play a direct role in pushing blood back toward the heart. When that pump weakens, blood lingers in the lower legs, leading to swelling, temperature changes, and visible venous strain. Heel raise holds target this mechanism precisely. By slowly lifting the heels and holding the position briefly, the calf muscle venous pump is activated in a controlled way. This improves the return of blood upward instead of allowing it to pool around the ankles and feet. Women tend to benefit more from this than they expect. Lower calf muscle mass is common, especially after 60. Targeted training helps restore venous efficiency, making circulation more responsive and reducing swelling over time. This effect is supported by research showing that calf strengthening improves venous pump function and leads to measurable reductions in leg swelling. To start safely, stand near a wall, chair, or counter for support. Rise slowly onto the balls of your feet. Hold briefly at the top. Then lower with control. This is not about height or speed. Tip. The hold matters more than how high you lift. Once the calf pump reactivates, circulation gains momentum, and that sets the stage for the final movement, where everything comes together. This is the movement that determines whether circulation adapts or keeps declining with age. Number 1. Wall sit, the vascular flush. If you walk regularly but still struggle with poor circulation or unstable blood pressure, movement alone isn't creating enough vascular stimulus. The wall sit solves that. Instead of repetition, it uses isometric tension. The muscles work without joint movement. During the hold, blood flow is briefly restricted. When you stand up, circulation rebounds strongly, flushing fresh blood through the legs. That rebound is the vascular flush. For women over 60, this matters. The wall sit delivers a high vascular stimulus with minimal joint stress, making it ideal for knee-sensitive individuals. The science is clear. A large meta-analysis published in the British Journal of Sports Medicine found that isometric exercise produced the greatest vascular improvements of all exercise types studied. Compared to aerobic exercise, isometric training improved blood pressure by roughly 80 to 100% more. It outperformed strength training, combined programs, and even high-intensity interval training. When all methods were ranked, isometric exercise placed first, scoring over 98% for effectiveness in improving vascular function. In simple terms, short wall sit holds beat longer, harder workouts for improving blood flow. To start safely, place your back against a wall and slide down slightly. Hold briefly, then stand up slowly. Tip. Stand up with control. The slow rise maximizes the flush effect. This isn't about adding steps, it's about demanding adaptation. Before you try any of these, one reminder matters. Start slowly. Pain is not a signal of progress. Circulation responds best to calm, controlled effort. Use balance support when you need it. That's normal. If you're unsure or managing a medical condition, consult a qualified professional before progressing. This isn't about fighting age, it's about working with your physiology. You don't need to do all 4 exercises. Start with 1, stay consistent. Small, targeted movements done regularly are far more effective than pushing harder or longer. If you had known this 10 years ago, which one would you have started with?